Welcome to the Georgia Veins Specialist close-up look at varicose veins. During the next half hour, you'll learn about a new state-of-the-art process to eliminate varicose veins. It's easy and effective, and there's very little pain. This revolutionary laser treatment has been covered by the national media, from NBC Nightly News to the CBS Early Morning Show to Good Morning America. It's an exciting new procedure that can change your life. If you've been living with varicose veins because you think the treatment is too expensive or too painful, stay with us. We'll educate you on what causes varicose veins, what you can do to treat them, and how we can work with you to get insurance coverage for the treatment. We'll begin with the story of one Atlanta woman who is thrilled with her legs after getting the new EVLT treatment at Georgia Veins Specialist. Forneris is all smiles now that her legs look and feel great. She suffered with varicose veins for years before turning to Georgia Veins Specialist.
They were large. I've heard them described as being roping. They were bothersome. They felt heavy. They itched a lot.
Charisse is not alone. 1 in 4 women suffer from varicose veins. Like many others, she avoided wearing swimsuits and shorts for years. After having children, her veins became even more noticeable and uncomfortable.
They caused my legs to look aged.
After years of trying to live with the problem, Charisse set out for help when she realized her varicose veins weren't just a cosmetic issue, but a medical one, and that insurance would cover her treatments.
Well, she came in last year and had symptoms of pain, throbbing, itching, and burning.
Dr.RaoKerwin did a thorough ultrasound to diagnose the problem. Georgia Veins Specialist, unlike many other offices, insist on doctors doing the ultrasound and following the patient from beginning to end.
He was from start to finish, and I think that's definitely, it was a partnership.
Dr. Kerwin first had Charisse try wearing graduated compression stockings, a conservative approach recommended by insurance. When that didn't work, he used several new procedures, including what's called EVLT, endovenous laser treatment. Unlike earlier treatments that required surgical stripping of the vein under general anesthesia, EVLT is an in-office procedure.
We numb up the site where we're going to enter in the vein using ultrasound guidance, and we wind up passing a small catheter through the greater saphenous vein or small saphenous vein or whatever vein that we need to treat using the laser. And then instill a dilute lidocaine solution around the vein using a skinny needle. Try to use something very, very tiny to infuse this lidocaine. That protects the structures around the vein, the skin. It also allows us so the patients don't feel anything when we're actually using the laser. And then by pulling that back at a certain rate, we can get a pretty good idea of how that's going to close. And when we're done, we just put one little tiny steri strip. It's just a little thing to close our little puncture site, and wrap them up with these 4x4s, a bandage, and compression stockings.
They make it a comfortable room for you. They lower the lights. You are reclined. They even put a movie in for you of your choice so that you can watch television, but they were so great. We chatted during the procedure.
Charisse also had what's called phlebectomy, the removal of small surface veins. It's also done in the office with local anesthesia.
And then the phlebectomy, where they remove the veins, he uses tiny little incisions and was very gentle and made sure I was comfortable.
As far as the treatment, I always consider myself the biggest baby, so I kind of treat patients with that same kind of kid glove that I like. We buffer the lidocaine to take the sting off of the lidocaine and numb it up, and I try to make the little punctures as tiny as I can.
Charisse also had what's called sclerotherapy, tiny injections directly into the veins. Here at Georgia Veins Specialist, they use this procedure only for small veins. As you can see here, there are immediate results.
Once we inject them, and it's tolerated very well, we use very skinny needles. We usually put some kind of compression, whether it's ACE or compression stockings.
Charisse only wishes she would have had the treatment sooner.
As a woman and a mom, I think we take care of other things and other people as a priority, and we make excuses to not take care of ourselves.
Varicose veins are common in women, and if you don't treat them, the disease does get worse. Why do so many more women get varicose veins than men?
Well, unfortunately, women, because of pregnancy and hormonal changes during pregnancy,
What kinds of things make treatment for varicose veins medically necessary?
Well, once the patients come for a visit, I can tell with ultrasound whether the greater saphenous vein or small saphenous vein or whatever is refluxing, is it dilated and does it demonstrate the reflux on ultrasound? The second part is the symptoms that the patient has. And have they tried conservative therapy?
Dr. Kerwin says anyone who is suffering with varicose veins should be evaluated.
The insurance pays for the initial visit, so you at least can figure out what's going on and here are the options.
Most often, conservative therapies are tried first and then more extensive procedures. But so much has changed in the treatment of varicose veins, it's definitely not what your mom or dad went through. In-office procedures with virtually no pain, no downtime, and insurance coverage make getting treatment easier than ever. And for those who avoid getting help, varicose veins can lead to skin irritation and even ulcers like this.
And if left untreated, simple things that are just pain or ugly appearing veins, it eventually turns to brown staining of the skin and edema where you get swelling of the lower extremities, and then even ulceration in our further down the road cases.
I feel like I took control. I feel like my legs look better. I know they feel better. And once I went forward, it was relatively painless and quite worth it.
We also asked Sharice what she thought about the staff and her experience at Georgia Vein Specialist.
The staff, from the moment you walk in the door, the staff is wonderful, friendly, confident, professional, but personable. You can relax and enjoy the company of the people that are helping you with the problem that you have.
Women aren't the only ones who suffer from varicose veins. About 18% of men get them. Up next, we'll introduce you to an Atlanta man who is now feeling better than ever after getting treatment.
Tired of painful, unsightly varicose veins? Want healthy, beautiful, pain-free legs? If you have dull, aching pain, heaviness, itching, or swelling on your legs, call Georgia Vein Specialist to schedule an evaluation by a board-certified MD. In-office procedure in about an hour.
These outpatient procedures allow our patients to return to their normal activities on the same day.
I often felt self-conscious about the way my legs looked, but after a simple procedure at Georgia Vein Specialist, I can wear short skirts again and I feel great.
For healthy, beautiful legs, call Georgia Vein Specialist.